Oh. I was not ready for that. Fiery face-offs, electrifying assaults, and very sharp things that come in all sizes. Today, we are breaking down and reacting to the very heated battles between Mortal Kombat and the DC Universe. Let's dive right in. Oh, nice. Wait a minute. I thought Superman could defend himself against anything. Obviously not. You're going to burn the skin. It could be as simple as a first-degree burn, which is like a sunburn, versus a second-degree burn, which just causes those blisters. Could be quite painful. And then could be even a deep second-degree burn that may or may not heal well. And then there's third-degree burn, which you singe it so bad that the pain actually gets a little bit better because you've like singed off all your nerve fibers. Oh. Oh, sweet, the opposite way. Sub-Zero, nice. We do see a lot of cold, hypothermic type injuries in the emergency department. Maybe not as much in Southern California, but when I worked up in the Northeast of the United States, we saw cold injuries, especially people left out in the cold. Frostbite, where basically they're usually fingers and toes turn black, and usually they're too late, so there's not much to do except amputation thereafter once it's been demarcated. Oh. The kiss of death. Fire injuries. If somebody actually has any concern for airway compromise, we will actually intubate them right away. Meaning, hey, we see evidence, singed nose hairs, soot in the back of the throat, burns to the face. You might be fine, but if we wait to see if you're fine and you turn disastrous, it might be too late. Oh, could you injure somebody's neck so bad like that and cause them to not live? Yes. Yes. It has to be a high cervical fracture, dislocation, spinal cord injury, because it has to do with your breathing apparatus, nerve impulses, as well as your autonomic nervous system functions, which kind of overlap into the same thing. Oh. Two different injuries, grabbing a hold of the neck and almost like a choking aspect. You're decreasing blood flow in and out of the brain. And then if you're strong enough, are you collapsing the trachea and not allowing somebody to breathe as well? And then add insult to injury, let me smash you on the ground and crush your lower back. Obviously, crushing your lower back is only going to inhibit the lower extremity. Your lumbar area sends all your nerves down from basically your hips all the way down to your legs. Whoa. Oh. Puncture wounds to the thorax. You don't know if it's going to the lung or the heart. You hit midline structures on either side, say a nipple line. You're going right through the ribs into lung tissue. You're going to puncture the lung and cause some bleeding, probably. So you get something called a hemopneumothorax, getting blood around the tissue as well as air, which then will push down on the lung itself, not allowing it to expand to get oxygen in. Oh, man. Massive compressive forces to your ears. It's going to cause a lot of pain to your eardrum and possibly a ruptured TM or tympanic membrane, aka your eardrum. And it's going to be very painful and maybe a little bloody because you do have a blood supply to this very thin piece of tissue. And if it ruptures open, it could bleed. We'll see this incidence where people have really bad ear infections and basically it ruptures open and you get the pus comes out, but then you also have a little bit of blood. Oh. I was not ready for that. It is an old school video game. Those things were so heavy. I mean, they're still out there causing crush injury. I just think it's funny because it's a Mortal Kombat game. They do a pretty good job in this scene where the body's still kind of like twitching, moving. Could that be because the character's still alive? Maybe. Versus action potential, so there's still movements. Even sometimes when people pass away, they could still move around because there's still the energy flowing that hasn't stopped yet. Oh, nice. Oh, man. The face can take a lot of damage without actually killing somebody. A lot of bone in the way, so the bones of the face can break pretty easily, but what's protecting the brain is a lot thicker. You have your frontal bone that's really thick up here. Your frontal sinuses, actually there's a gap in there. That can actually break, but typically it's the outer part that breaks first. And then obviously your cheeks can break pretty easily as well because there's air pockets behind that. Oh, Nice. The biggest things that we worry about with electrical injuries is cardiac arrhythmias. Typically will cause people to go pulseless. How do we get them back? We need to shock people out of those. That's the best way you can help somebody. VFib or VTAC. Those are the two rhythms that you can actually shock. You can't shock any other rhythm. Won't work. Where's everybody? If you are a gamer and are playing this and you want to stay sharp and focused, that's where Level Up comes into play. Visit lifehappens.com, and we're also on Amazon. Check it out. Oh, wobbling around. Oh, 2 stab wounds. Probably getting into the heart a little bit. Maybe on that right side you're gonna miss, but sometimes people have really big hearts. It's actually not good when you anatomically have a big heart. Figuratively, yes, but anatomically, no. Typically means that your heart's working too hard. You want just a normal size heart. Massive blow to the abdomen. How does that get you? Does it explode your organs? Does it rupture your liver? Does it rupture your spleen? Does it crack open your abdominal aorta and cause you to bleed out? Does it rupture your kidneys? All the above could potentially happen. We see these with massive traumas to the abdomen, usually relating to car accidents. Whoa. Oh, geez. Big laceration to either the neck or the chest. We don't see the effects of it. We just see a little splash of blood, which is fine. But anytime somebody has lacerations around the neck, especially between your jaw and the clavicle is zone 2, we really worry. And typically if it's, through the skin, you're gonna be taken to the operating room to have exploratory surgery to make sure nothing is damaged underneath. Oh. There are people that can throw cards that intensely that can actually cause lacerations. People can use anything to hurt each other. Please don't. Here, obviously, these wounds aren't that deep and should not cause life-threatening injury. Obviously, it's a lot of soft tissue, maybe a fracture of a bone, but they're not going deep in there. Oh! Catwoman.
Meow.
Cats in general wreak havoc on our systems relating to possible infections. There's always bacteria related to their nails and their teeth. They can puncture into the tissue and that bacteria stay. When you get a big cut, you're always worried about infection, but it's big and open and it bleeds a lot and you can clean it really well. So the likelihood is low versus when somebody gets a puncture wound from an animal, it just seals in. Oh. Big sword right to the middle abdomen. What are we hitting? High up there, we call that the epigastric area. So your stomach, your pancreas, those are big structures midline. Your intestines, your omentum, and then obviously you always worry about your inferior vena cava, the big blood vessel in the abdomen, and then your abdominal aorta, which is the big artery. Mortal Kombat versus DC Universe. This was intense. This was a lot. Let me know who's your favorite character of this game, and do you want to see me react to more Mortal Kombat, more DC Universe? Let me know in the comments. And as always, if you guys enjoyed this, definitely check out this playlist right here, binge watch everything, and don't forget, subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.